So what we're going to talk about here is grief and loss, or the stages of grief that we need to know about. We know about it. If you don't know about it, we're going to cover it here. Okay, so I'm just going to look at my notes. Okay. Elizabeth Kubler-Ross, an American psychiatrist, born in Switzerland, but lived in America. In the 1960s, she did work with terminally ill patients, and she noticed that there was a pattern where they came to terms with their mortality, that there was that they went through different psychological phases to come to terms with their mortality, and she studied that, and she classified that the 5 stages of grief. And here they are here. Denial, that first one. No, that's not true. It couldn't have happened. So, anger, depression, bargaining, and acceptance. So this offered people an understanding of a complex experience that an individual may go through with grief and loss. So this was easy for people to wrap their heads around, but it became part of the popular culture, and that there was books written on it, there was TV interviews, articles written about it. We study it, we know about it, we should know about it. You probably know about it, but if you don't, we're going to cover it in a little more detail here, because there is not a DSM-5 diagnostic code. There's no DSM-5 diagnostic criteria, or for grief or grief and loss. We're not going to see that in the DSM. But our patients that we're working with could be suffering from grief and loss. Why? Because the opioid overdose epidemic, it has topped 100,000. It's an all-time high now. It topped 100,000 in 2021. And that was up from in the 76,000 the year before, 50, 60, 70,000 the year before that. So it's at an all-time high. So when we do these Narcan trainings, and we've done some other lectures that I do, when I ask the regular audience who knows someone close to them, family member or friend, who has died from an overdose, and everyone raises their hand. So when we look at the general population, everyone knows someone who's died from an opioid overdose. We're in a drug overdose epidemic, okay? But our patients in the population that they hang out with, every one of them has known someone, friend, family member, best friend, boyfriend, girlfriend, and I have worked with patients who I have identified that their trauma is grief and loss. Okay? So we need to know about this, because this is the patient population that we're going to be working with. And as part of patient education, which is one of the 12 core functions, we need to educate the patients that they're going through these stages of grief and loss. So in this model, individuals who are going through grief and loss, they go through these stages, but there's a numbness. They're unable, their mind is unable to accept and understand the emotional, psychological pain. So when we educate them about these stages, or that this is a process that they go through, it's something that they navigate their way through, they can come to a point where the acceptance phase, although it's difficult for someone to accept the loss of a child, the death of a child, but they'll come to a point where they realize that they can accept it, or they can move forward with their own life into the future. And we want to help them navigate their way through these stages of grief, and that's why I'm including it in this this training on trauma-informed care. Okay, so our education, our knowledge is helpful to our patients, particularly in a trauma-informed care approach. Okay, patient safety being the primary goal, which again is the name of this course. But a good thing we can do for our patients is educating ourselves and taking care of ourselves our own health and wellness, because healthy counselors equals healthy clients. Okay, so our own health and wellness, we're a role model for our patients. We want to be taking care of ourselves too. It's very important in the trauma-informed care approach that there should be a culture of wellness within your agency, that the clinical treatment team is doing well, okay? And the patients will do well. So I just want to give you a little bit more information. So what we have here is another example of stages of grief, a pattern, a phase that an individual suffering from grief and loss has to navigate their way through, or we can help them navigate their way through. It starts with the loss, hurt, goes through these negative effects that they may feel. It comes up to a part here where loss adjustment or helping others. And there are self-help groups for individuals who have suicide survivors. That's someone close to them has committed suicide, or other grief and loss. They've lost a family member, and God forbid anyone loses a child. But there are phases that they go through. So as part of patient education, and we're educating our patients, and we're working with them to help them navigate their way to get to a point where they can actually move forward with their own life. Okay, so that's why I'm covering this material in this training. So because I've worked with patients who have not had been working with someone, and this is their experience. Okay, they're jumping around all over the place. Okay, it's debilitating, but it's paralyzing, and it's very complicated. It's a complex issue. So with our help, with individuals who are experiencing grief and loss, we're going to counsel them and understand that. And this is an important part of trauma-informed care, or their trauma-informed care approach, that we know not just the diagnostic statistical manual of the mental health disorders for trauma and stress, that there are people who are suffering from grief and loss, and we want to help them navigate their way through. So we're just going to cover a little bit more about those 5 stages of grief, so you know a little bit more about them. And I'm just going to let you read your way through that. Okay? Okay.